Wrist arthroscopy is similar to other arthroscopies, except the joint is much smaller. So we have to use smaller instruments to do the wrist arthroscopy. And there are a myriad of conditions that we can treat through wrist arthroscopy. Typically, we'll do 3 or 4 small poke holes on the back side of the wrist, right along here. And we'll insert the arthroscope, which is a small television camera, through those little poke holes. We're able to assess the smooth or articular cartilage of the wrist and also the many intricate ligaments that are in the wrist. There's also a piece of cartilage in the wrist that can frequently be torn. It's called the TFCC, and that stands for triangular fibrocartilage complex. That's on the outside of the wrist, or what we call the ulnar aspect of the wrist, and that typically gives people significant troubles who are in racket sports such as tennis, baseball, or golf. Those type of sports, people tend to irritate and or injure that, and that's something that we can treat arthroscopically. Now, an arthroscopic wrist procedure is an outpatient procedure, and patients will go home typically in a small splint that we can remove usually in about 10 days. Now, in the instances where we repair the TFCC, we need to remain in a splint for about 6 weeks.